In this video, recorded February 2026, I'm injecting CK3 anteromedial cheek in the deep malar fat pack compartment, and I want to walk you through it. I start with marking the mid-pupillary line, which helps to locate the infraorbital foramen and artery marked in red. Next, I mark CK3, which starts at the lateral aspect of the lid-cheek junction, traverses the zygomatic eminence or CK2, moves downward to the level of the nasal spine, and curves back up to the medial side of the lid-cheek junction. I divide CK3 into 3 compartments to help with precise injections. Next come 2 cleaning steps. For cannula injections, first I clean the general area that the cannula can touch the skin. Then I pinch and pull where I'm going to place my introducer and clean the introducer entry point. Next, I place my introducer distal to my pinch and widen the orifice with 3 circular movements. The introducer is removed by my assistant and I insert the cannula. I start with the lateral compartment. My cannula is deep, pointing towards the bone. I'm protecting the orbit from the tip of the cannula with my assisting hand index finger. I inject 0.2 cc's in the lateral compartment. Next, I inject 0.1 cc into the central compartment. I'm still in the deep fat layer, going very slow. Last is the medial compartment, where I inject the remaining 0.2 cc's a bit more superficially. Lastly, when I'm done injecting the area, the cannula is taken out and gauze is placed on the orifice to stop any bleeding. MD Codes is an advanced injectable methodology created by Dr. Mauricio de Mayo that teaches injectors how to assess and treat the face with structure, precision, and strategy. Instead of chasing individual wrinkles, MD Codes looks at the entire face, including bone support, fat compartments, ligaments, skin quality, and muscle movement. MD Codes teaches injectors how to assess the face globally rather than treating isolated areas of aging. I often compare it to building a house. First comes the foundation steps. Then comes the contouring and structural steps. And lastly come the refinement or the decorative touches. Facial rejuvenation works much in the same way. Treatments typically begin in the middle third of the face with the cheeks because the cheeks act as the foundation of the facial support. From there, we move into contouring the upper and lower thirds of the face, including the chin, jawline, and temples to restore structure and balance. Only then do we move into the refinement phase, treating areas of perioral or around the mouth, including the lips, and periorbital around the eye, such as the under eye. In this way, MD Codes creates a precise anatomy-based treatment plan built around what the face actually needs, not simply where a wrinkle happens to appear. What makes MD Codes so powerful is that it transforms injectable treatments from subjective artistic preferences into reproducible systems grounded in anatomy, assessment, and structure. For me, MD Codes completely changed the way I approach facial rejuvenation. It is not about overfilling, it's about understanding the architecture of the face, and when done well, the results should whisper, not shout.